Alencia Johnson, welcome to The Hill TV.
It's good to be here.
So you are Director of Public Engagement at Planned Parenthood Action Fund. Just explain for our viewers the difference between the Action Fund and the Planned Parenthood that people may know in their own communities.
Absolutely. Well, the Planned Parenthood that people know in their communities is probably one of our over 500 health centers that are run by our over 50 affiliates, part of the Planned Parenthood Federation of America, which is where we do our sex education work and serve over 2.4 million patients every year. Planned Parenthood Action Fund is our advocacy arm where we're able to throw down to protect access for women's reproductive health care and access to safe legal abortion.
Yeah, and you don't just do you don't just do sex education. You also do screenings for cervical cancer and other things, right?
Absolutely. We do everything from women exams to screening for breast cancer, cervical cancer, ovarian cancer, contraception screening, working with patients on the best option for them, because the birth control pill may not be the form of contraception that they want. They may want an IUD, they may want other methods. We also do pregnancy counseling, including access to abortion care. One of our largest growing patient demographics is actually men. They're 12% of the population that we serve, and everything from STI testing and treatment, HIV testing and treatment, counseling, condoms, of course, and even in some states we offer vasectomies. In over half of the states that we provide care, we actually offer hormone replacement therapy for trans patients. And so we are a very inclusive provider, and we see the whole person as they come in. Over 60% of our patients rely on government-funded insurance programs like Medicaid or Title X, which is why the work that we do in our advocacy arm is so important to ensure that these patients have somewhere to go.
When I was looking up Planned Parenthood and really doing some of the research, I looked back over the 100 years of your history and seeing it all together, the amount of resistance to just having a conversation about birth control in this country from the very beginning. So this is the obstacles you're facing are not new, right?
Right. Well, we were pretty much born, I like to say, out of the resistance. Margaret Sanger, through her great achievements and some of her flaws, her crusade was to ensure that every woman had access to birth control. And in the early 1900s, that was illegal. And so she was locked up for passing out birth control pamphlets in New York. And then she went to jail and started counseling on birth control in jail. And so we were, and not just Planned Parenthood as an organization, but this movement of contraception, birth control, but also more importantly, women having agency over our bodies, over sexuality, and being open about that started as resistance. And the places in which we expanded, from whether it was the South, the Midwest, inner cities, wherever it was, there was always some sort of resistance, typically from people who don't have to use birth control.
Right. And you couldn't even have conversations with married people about birth control.
No, I mean, up until the 1950s, that it was illegal for folks who weren't married to have birth control, right? And there are so many different laws that restricted the conversations husband and wives could have, and then take out the fact that people are married. What were those women able to do?
So from that period of resistance and getting birth control part of the American conversation, we then got the ACA, Obamacare, where it seemed like we were getting healthcare as a part of the conversation in a more formalized way. But now there's resistance to that and efforts to peel that back?
Absolutely, and I'm so glad you mentioned Obamacare and the Affordable Care Act, because Planned Parenthood, as an advocacy arm, people just think of the healthcare that we provide, but our advocacy is so important that we were instrumental in that fight for ensuring that birth control was able to be covered at no copay. And that saved women so much money, especially low-income women. As a woman of color, I think about the fact that Black women, 40% of Black women have a hard time paying for birth control at $10 or less. And so to be able to go to your pharmacy and not have a copay was groundbreaking. So thanks, Obama. But sometimes all good things, I don't want to say come to an end, but face some resistance. And since day one, this administration has taken attack after attack on women, whether it is through the domestic gag rule, in which they are trying to ensure that Title X patients can't go to a Planned Parenthood Health Center, when we see over 1 million of all of the Title X patients, which is the government's insurance plan that actually covers reproductive health care and contraception. They have been trying, through the repeal of the Affordable Care Act, to block Medicaid patients from going to the provider of their choice. And how absurd is that you are telling low-income folks that they cannot choose their healthcare provider if their healthcare provider happens to be Planned Parenthood?
Well, that is one of the questions, right? It's not that women won't get health care. The question is whether or not women in rural areas, poor women, are going to be able to get the same health care that women with funds are able to do.
Absolutely, and that's what we hear from our patient stories all the time, is that they know that if they lost access to healthcare at Planned Parenthood, they would have nowhere else to go. It is completely false that some of these other federally funded types of health centers can absorb the amount of patients that come to Planned Parenthood, specifically for the services that we provide, which are the well woman exams, the cancer screenings, the contraceptive screenings.
Okay, so your job is to go out and tell the story and try to make public policy change. How are you doing that in a year like this, where we have an election coming up in just a couple of months?
One of the most powerful things that Planned Parenthood does is actually lets our patients speak for themselves. And our patients have not only been the core of this resistance, they have become activists. Some of them are even running for office because they are saying, you are taking away my health care. There's also this conversation where we have to normalize this conversation around women's health care, around access to abortion. 1 in 4 women will have an abortion at some point in her lifetime. 1 in 5 women will visit a Planned Parenthood health center during her lifetime. And
there'll be a lot of men who are involved
and there will
in that
be a
too.
lot of men, exactly,
Right.
and gender nonconforming folks, right? And so to constantly tell that story over and over so that people realize, oh, someone I love, someone in my life is actually going to be impacted by the rolling back of this care, makes it real. And so you and I can continue to have this conversation, but it is that person-to-person conversation, which is why we just left Detroit a few weeks ago, where we had our largest organizing summit. And
my hometown, so I got to get Detroit to pick up.
Well, yeah. I love the energy in Detroit, and people came from all 50 states, thousands of Planned Parenthood patients and supporters, to get the resources to go back and organize in their communities, not just on who to vote for, but the policies that they should be organizing against. The reason that the appeal of the Affordable Care Act was defeated 3 times is because those hundreds of thousands of calls that went into Capitol Hill. I'm sure folks were tired of getting the phone calls, and they were tired of their town halls being flooded by folks like Deja Fox, who, a teenager telling a senator that she knew more about her health care than he did. They were tired of hearing that, and so it was defeated. And our patients understand the power of their voice, and I think that is the most powerful strategy that Planned Parenthood has.
So do you have organized movements that are taking place during this political season?
Absolutely, and one of our electoral programs is our Win Justice program, where we are focused on 3 specific states. That's Michigan, Florida, and Nevada, and we're working with some of our community partners like Center for Community Change PAC, as well as Color of Change PAC and SCIU, and we're getting on the ground and listening to supporters, listening to people, women of color, folks of color, LGBTQ folks, low-income folks, immigrants. We're listening to them and understanding what it is that they're looking for and how they need to be mobilized, and giving them the tools to mobilize their own communities, right? We could fly in from Washington or New York, great, but it's actually more powerful when you have people on the ground who know the community, who also know the issues, and know how this all correlates to be the leaders in their community, bringing folks out to vote.
So now you haven't had a completely glass path here. There are some problems that Planned Parenthood has come across. Tell me a little bit about how you react to the critics who take a look at some of the things. I mean, there were videos a few years ago that came up. You've got an energized opposition out of the conservative part of the country. How do you answer those critics who are concerned about what Planned Parenthood is up to?
Absolutely. Well, here's the thing about the smear campaign is investigation after investigation showed that we were at no wrongdoing, whether at the state level and in Congress, and they keep trying to bring it up, but there's literally no wrongdoing. And the interesting thing that we see is that the harder they push against Planned Parenthood, the more energized our patients and our supporters get. So if you are coming and attacking Planned Parenthood, we've got a whole pink army that is larger than any other liberal or conservative, progressive movement, and I won't even name any of those organizations, but we have a whole army of supporters who will fight back, who will fly in from whatever state they're in to Capitol Hill and let folks know that this is wrong and you are taking away health care from people who have literally nowhere else to turn. And when I hear that, especially as a Black woman from the South, and I've been privileged to have insurance my entire life, having insurance shouldn't be a privilege. I've had, the doctors of my choice. That shouldn't be a privilege. And when I hear that people's healthcare is being taken away like that, it's literally a matter of life or death.
Mm-hmm, mm-hmm. And there's so many women who don't have anywhere else to turn
Absolutely.
when they hit some of these snags, and they need a place like Planned Parenthood or somewhere else where somebody's going to help take care of them.
Absolutely. I mean, we hear from patients all the time that they say even if they have gone to other doctors, it was at Planned Parenthood where they found the lump in their breast at an early stage, and they were able to be referred to go get the mammogram, and they were able to confirm it, and they were able to survive,
okay.
Right?
So this year, you've also got, in addition to elections, you've got a Supreme Court nominee mm-hmm. who is being put up. Republican president, mm-hmm. Republican Senate. Mm-hmm. Can you stop him?
Oh, absolutely. We can stop him. And I know people feel as though it's an impossible uphill battle, but I think when 2017, after January 21, 2017, and the first thing that folks were saying was we were going to defund Planned Parenthood, we stopped that not once, not twice, 3 times. And I firmly believe that if the people rise up, if folks continue to put pressure on their senators, especially some of our champions who may be Republican, letting them know that this is actually not what the people want.
Which senators?
We have Senator Collins and McCroskey,
okay.
Of course.
You nervous about any Democrats?
I think what we are focused on is ensuring that folks are shored up as a champion for women's health care. Because most of these people, they actually pride themselves as being champions of women's health care, and they pride themselves on representing their states. And as long as their constituencies continue to tell them that this is a priority for us and we are expecting for you to continue to protect our access, I think that they hopefully we have confidence.
All right, you don't want to name names.
I don't want to name names.
Okay, I got it. Thanks for joining us.
Absolutely.
Alencia Johnson.
Thank you.
Appreciate you being here. We've got more Rising coming up right after this.